And welcome back, Movement Underground Radio. Here we go again. Today I have a very, very special guest. This is a very meaningful person in my career, and I'm going to introduce him by maybe sharing the story, a quick story of how we first met. But today I have the Mojo Master himself, Dr. Perry Nickelston of Stop Chasing Pain. And real quick, before I let Perry rip, so I met Perry back in like 2012, and the first time I met him, I was actually a student in a rock tape course, and I hadn't really previously heard of rock tape, although I had been doing some kinesiology taping prior to that. So I take the course, I'm sitting there, and I'm just watching this guy dominate the room, blowing people's minds, mine included, and I just remember sitting there thinking to myself, man, this material is game-changing, and I would love to be able to teach this one day. And, you know, lo and behold, it was like 5 years later or so, I got the call from Rock Tape 2. But Perry, you were so influential on me early on, man. And I just can't thank you enough for coming on the show and chopping it up with me.
Thanks for having me on. What about a full circle, huh? That's pretty cool.
I know. It's definitely a full circle thing, but I just remember thinking, oh, my God, this guy is on another level. Like just your composure, your ability to speak, to take these complex neuroscience concepts and really break it down in a way that was super palatable and easier to integrate. And I just really appreciated that about you. And you've been a role model of mine ever since. So again, I can't thank you enough for coming on. Today's topic, we are going to get in. I'm literally just going to throw you a freaking fastball right down the pipe, man. 80 miles an hour on the tee, lay it up.
That's the way I like it, man. Straight up.
So, Perry, you're obviously a master of a lot of different aspects of movement and physical rehab and treatment, but I think obviously you've taken the reins on a lot of lymphatics and how our lymphatic system really plays more of a heavy role in health and human performance than I think a lot of people give it credit for. You know, I think a lot of people, we learn about lymphatics as like a chapter in our, education, and then we kind of never consider it again. So what was your aha moment on the lymphatic stuff? Like when did you start to see, okay, maybe this is a bigger hinge that swings the door than we think?
Yeah, great question. And I agree with you. I mean, I didn't really pay any attention to lymphatics through most of my career because I didn't think I had to, honestly. First of all, they didn't really cover it when I went to school. And if they did, it was only in relationship to a particular condition, lymphedema.
Right.
Which is where something happens to the lymphatic system and body parts get abnormally swollen, and there's no cure for lymphedema currently. And you would just go for some lymphatic massages. And I figured, okay, well, I don't have that. Why do I need to worry about it? And the patient base that I was seeing didn't have it because mine was more of a musculoskeletal pain, discomfort, movement-based chronic pain type of issue. And
right,
maybe
like most
some,
of us, yeah.
Yeah, I mean, that was my wheelhouse. It was maybe some neural-based, a little bit of neurology, right? And then the other aspect that you would look at lymphatics are when cancer's on the radar, because we know that, people have lymph nodes removed when they have cancer, or that cancer can spread through the lymphatic system. But the lymphatic system also kills cancer cells every day, so hopefully you don't get cancer, all right? So it wasn't there, but actually it needed to be for me out of necessity. So I had to rescue myself because I started to suffer conditions that were not musculoskeletal based. Mine was more of a chronic inflammation, autoimmune disease type. And I really never got an official name for what mine was. In fact, I felt like I had all of them, to be honest with you. I think I had more than one. They call that polyautoimmunity. And I was just really suffering, and I was not getting better. And the traditional approaches that I was going to see for help were not helping. They were actually making me worse. And how I was going about trying to help myself from all of my prior training was not enough to help me either. So that's when I said, okay, it's time to think differently. And that's when I had to go back to the drawing board and say, why is all this stuff not working? And what do I need to look at to try to heal myself? And that's when I came across the lymphatic system. And when I did, my whole life changed in many different ways because I discovered how incredible the system is. And then it's the only thing that brought me back from the abyss.
I mean, I didn't actually know that part about you, that this was kind of and again, I think that's kind of how a lot of us stumble onto these things, is personal experience kind of brings our knowledge base into question a little bit, and it forces us to maybe take a different lens, you know? And I think, I don't know if I heard this from you, but like, it's really like the lymphatic system is one of those systems that when it's working, you never know. It's like the plumbing in your house, literally, right? When unless you have a problem, you might not even know it's there. And that's kind of the point. It's always working. It's always doing its thing. You know, for me, and this is kind of, and I actually pulled a lot of the lymphatics that I learned from you into my course for the acute injuries, right? I call it End of the Ice Age. And, you know, I started going down the rabbit hole of, you know, and again, when I blew my knee out, I was burying that thing in ice every 20 minutes out of every hour because that's what I was told to do. And I did it religiously, thinking that this was going to give me the best possible outcome. And what I kind of, and this was when I was like 18, so I didn't have a freaking clue anyway, but I was always swollen. I was always swollen. It was like no matter what I did, burying it in ice, getting in the cold whirlpool, my knee was always swollen and stiff. And so, you know, through that experience, and then obviously treating and training athletes, and especially in an athletic training setting where I'm seeing a lot of acute injuries and subacute stuff, it's like there's got to be a better way to manage this, because it just never made sense to me. If we're going to constrict blood vessels and tissue with using a cold modality, it's like, well, our lymphatic system is going to be affected negatively as well. And if we're talking about swelling and evacuating swelling, we got to have a better solution to that. And so what I did was I kind of pulled, as I was learning from you and applying these things to my athletes, I realized, holy shit, this is so much more powerful than people even have a clue. Because, you know, I had for example, like even one of my Google reviews, you could read it. I had a kid post medial patella ligament reconstruction, right? So he dislocated his kneecap, he had it reconstructed. And just doing some basic lymphatic drainage massage and teaching him how to do it, he was swelling free within 10 days, full range of motion. We really didn't do anything else. You know, maybe some basic exercise and quad sets in that early acute phase. And I'm like, man, this is the ticket. This is how we expedite that early phase and maximize the long term. And that's really my interest in it, is like, because a lot of the research, right? A lot of people want to look at research and look at the evidence, right? That's the big wave now. And you look at a lot of lymphedema research, and it's all cancer related, right? There's very little studies that look at this from like an acute injury or orthopedic standpoint. So have you used it for like on the acute side of stuff? Like,
oh yeah.
And is it just me like with my own confirmation bias, or I feel like that's maybe the future?
No, it's not biased. You're freaking right, because it's just based in physiology, and it's actually physics too. Right. It's based on how fluids move in your body. That's hydrodynamics or hydraulics. And when you look at it, it's a whole heap of common sense at the same time. Right. Right? And you touched on it before, right? So I'll get back to my story in a minute in relationship to why it helped with inflammation, because it's a primary system that helps get rid of inflammation. So you might want to look at that, because that's part of your immune system, right? So inflammation is an immune system response. It's not a musculoskeletal one. Everybody should hear that one and repeat that 1,000 times.
Yeah, people make that mistake, right? It's like the same system that heals you from an infection is the same system that's involved in healing. I always say it's like the lymphatic system is like the bridge between your immune system and your circulatory system. It's the bridge between the two.
It's the same thing in my world. It's both.
I love
if you have a problem with one, you got a problem with the other. You cannot separate the two. It's impossible. First of all, you can't separate any system in the body or any body part, and that's the mistake that people make, is they chase body parts. And that's where Stop Chasing Pain started, is that you start where it hurts and then you look everywhere else. That's it. Okay? But then it just comes down to putting the puzzle piece together and thinking logically about what you're trying to do, right? So the if you think about an injury to your knee, right? And I'm sure that's how you came to it. Well, you've got damage there. I don't care how, maybe it's surgical damage or you fell on it or whatever, okay? And there's some injury to the knee. Well, then healing needs to take place. So then you have to ask yourself, what in the world does a cell need to heal itself? So you need to repair the damage that's there, but you also need to make new cells, right?
Absolutely.
That's called regeneration. That's called, making yourself #beast mode monster so you can become stronger and resilient to have a better knee. Sometimes your knee is better after you injure it than before it.
Right.
So you have these cells, and the cells need actual nutrients to be able to repair themselves. Okay, you name them. I don't care. Whatever you want to throw in there. And they need oxygen too, because if they don't have oxygen, they're not getting better no matter what you do. And then I ask people, how do you think those things get to that cell? They get there through fluid.
Right.
And then I say, what type? Well, that's arteries. And so the arteries have to get to the knee. And then I ask them, where do they come from? They don't just magically show up at the knee, right? They come from higher up.
Right.
Right? The heart beats, it goes down through your aorta, then it goes down through, I call them pipes, and, they change names and they change sizes, but it's still the same pipe. So I don't care if you know the names of the arteries or not. I need you to know where they go. So they come from the abdomen, then they split down a pipe down your left leg, then your right leg, and then they go to your knee, okay? So if it gets to the knee, then your cells there are actually going to use all those nutrients, right? Or you have damaged cells and inflammation there that needs to get out. So once the cells use the nutrients and use the oxygen, they make energy. And when they make energy, they make waste. And your damaged knee tissue is also waste.
Right.
And then you got to get that stuff out of there. That's why you were trying to ice stuff up, right?
Right.
And then I ask people, well, how's the waste getting out and where's that going? The only way that's getting out is through fluids. That's it. Veins and lymphatics, those two.
Right.
Right? That's why the two systems connect with each other. And interestingly, the lymphatics embryologically grew from the veins. So they're interconnected. And then I say, okay, well, when you're trying to work that knee and you got to get rid of the waste, where's that got to go? It's got to go back up because
Right.
It's got to get out. And where that goes is the collarbone, because that's where the veins drain to and the lymphs drain to. So they go to the collarbone, and then I say, once it hits the collarbone, where's it go after that? Well, it goes back out into the circulation again, because it's got to go back to the heart, and then it goes out through the arteries, and then the arteries take that stuff back out into the organs to get rid of it. So you can pee it out, you can poop it out, you can breathe it out, you can sweat it out. You can detoxify it, right? So all these systems connect to each other, and they're just called different names when fluid hits different systems.
Right.
But it's the same stuff.
Right.
And you have to think logically of like, well, I better clear the areas, not just in the knee, because I already know your knee's a hot mess because you're pointing to it and it hurts. But I have to look at the stuff higher up, because that's going to determine how well your knee gets better.
Right.
So when you did your ice, okay, you're trying to drive the fluid out, but then you have to ask yourself, what if there's blockages higher up? Right? And here's the thing. I already know there's blocks higher up, because you've had trauma and you got tightness and you got tension. And what most people don't think about is how well you recover from an injury depends on the state of your body before your injury.
Yep.
Like, how was your lymphatics and your blood flow before you got hurt? And just because you don't have pain doesn't mean that they're good. And just because you're an elite athlete and you're number one and you look great in the mirror doesn't mean they're good either. It just means that maybe you can compensate and adapt better than somebody else. But when you get hurt, you're struggling to get better, because it's not just that injury. It's maybe you've had 20 years of a problem of poor microcirculation to your knee you didn't know about from all the other prior injuries that
Right.
you've had. That's why your prior injuries make a big difference on how well you're going to get better.
Totally.
So I already know when you have an injury, you got a blood flow and lymph problem. It just depends on how bad it is.
Yeah, I like to phrase it, it's like, if you, when I talk about, the accumulation of swelling, it's like every injury you have, there is a swelling or edema component to that. Now, if your body is working well, if, like you said, if you don't have blockages upstream, you might have very minimal swelling or maybe not even any swelling at all, because the rate at which that fluid is accumulating is equal to the rate at which it's being evacuated, and you're gravy at that point, right? But when I tell people, it's like, well, I tell my athletes, right, especially like high school, college kids that really just can't wrap their head around why I'm telling them all this light touch stuff, and I'm going to ask you about that in a second. But why they're massaging certain areas of their body that have nothing to do with their foot or their ankle or their knee. And I say, listen, if you're in a shower, right, and you got a slow drain, and about 10 minutes in, you're in freaking shin deep water, do you just turn down the water out of the faucet, or do you? The problem is a drain problem. It's not a faucet problem. So you have to use a drainage solution to that. And I think a lot of people, especially people go, yeah, but Mike, I ice my knee and the swelling goes down. I was like, again, do you understand the physics or the chemistry of what happens when you make fluids colder? They get denser. So yes, the volume shrinks, but now you've made that fluid thicker, more viscous, and now it's even harder to get out. Now it's going to sit in there even longer. Like, I'd almost rather you get some cardio, get your tissue temperatures up, hop in a sauna, right? And just do these basic things to kind of get the system moving. And I think, again, my whole point of my course was kind of like a cry for like the common sense factor of like, we get post-operative athletes or post-injured athletes or even anybody, not even an athlete. It's just the vernacular I use, but it's like we tell people just to rest it and lay there and just do nothing. It's like there's so much that we can do in that early on that has such a huge impact on people's healing. And one of the things you just mentioned that I just wanted to touch back on is, I think it's obvious, when we say like somebody who's maybe like, overweight or has, chronic metabolic or cardiovascular, deficiencies or things like that. I think it's easy to see that they're maybe not going to heal as well as somebody who's in really good shape. So I think that's an excellent point. Like when you say, depending on what your body's like pre-injury, but what's your, when you get like a pro athlete who looks great in amazing shape, you still see that that's an issue for people?
Oh, yeah. Huge. Yeah. Well, it's a proverbial analogy. I mean, you may have a great looking chassis, but I don't know what it's like under your hood, man.
Right. Exactly. Okay. I get what you're saying.
Right.
Totally.
So athletes
looks can be deceiving.
This is what, And in that vein, before I answer that question is that, I always tell people the ice is not getting rid of your swelling. The lymph is still getting rid of your swelling. You're just trying to use ice to do it. It's still got to get out. No matter, you can do anything you want to that knee. Laser it, ultrasound, rub it. X, Y, Z, whatever your favorite take is that you got the research on, it's still got to drive the fluid to the same damn place.
Right.
So you better be clearing your pipes higher up. Otherwise, I don't care what you do.
Let me ask you this, because as obviously I was turned on to this topic by you years ago and did my own research and kind of dug down the rabbit holes a bit and decided, I was like, this is compelling. I've been using it. I'm going to integrate it into my course. And I thank you for that. I give you credit in my course as well. It's like, if people want to learn more about this, I'm just scratching the surface. Like, you're really the depth of understanding here. But when it comes to all these like lymphatic drainage, like certifications, I get this all the time on social media, and I just kind of wonder what your take and how you handle it. But people get so entrenched in like it has to be done a super specific way, and it's like the Vader approach, it's this dude's approach, it's like always named after some guy, and it's like, and the people who follow those protocols are like nothing else exists. And I'm like I'm like a pragmatist. I'm sitting here thinking, I'm like, okay, I get that there's some concepts here that we want to apply, but do we really need that high level of specificity, like directions and just the right amount of pressure? Like, I agree with you in your big six. I call it pumping stations, like the big areas where we have higher densities of lymphoid tissue. But what's your take on that? What's your take on all these certifications?
First of all, I know what you're talking about, and it's not just in the world of lymph. It's for every freaking thing you can imagine.
100%. 100%.
Everybody is like, my way is the right way, and if you don't do it that way, you're wrong and you're stupid. Just like, here's the thing. They all work.
Right.
I just want you to be tuned into lymphatics. And those are great programs, but here's the one word I'm going to use for you, context.
Right.
It has to be based on the individual that you're working with. What do I mean by that? If you have somebody who has lymphedema and damaged valves and a severely compromised system, you're probably going to have to do techniques that are very light, very gentle, little and often, and slow based on the person that you're working with. But then I'm going to tell you, you better not isolate the lymphatic swollen body part. You got to look at the whole system.
Right.
Okay, because they make that mistake a lot of times too, depending on where you got certified. Right? So that's where you have to change your techniques, if you will. Right? But you remember when we talked for rock tape that when you understand a concept, you have a billion techniques?
Right. Absolutely.
The same holds true. I mean, they still got to hold true to the physics of fluid flow. That doesn't change. But where I am going to differ from them is this. Okay? Because they talk about your lymphatic system being so sensitive, and if you push too hard, you're going to shut stuff down. If you have lymph damage, yes. But you need to think about this logically. If your system was that sensitive, you'd be dead in a day from the pressure you get from a regular massage. It doesn't just stop everything, right? Because then I'm going to tell you it matters how the order in which you massage areas when you're trying to move fluid as to how it's going to drain.
Right.
Which means you can't just start rubbing body parts and expect fluids to move the way they need to.
Yeah, like that traditional milk massage. Like, I got a swollen ankle, I'm just going to smash this swelling out of the ankle, and then that's it.
You got to
right?
be strategic.
Yes.
And you got to understand when you push here, where is it sending stuff next? That's what you got to know.
And is there room? Is there space for that fluid to go, right? So can you break it down? Like, what's the order? What's a good a conceptual order of approach of like the checkpoints in your mind of how you might want to attack, a lower extremity, let's say?
Beautiful thing about my concepts is that they're all based in physics. So I don't care whether you agree with mine or not, they're still true.
I love it.
It's like Elon Musk says, if it's down to physics, it's either going to work or it's not going to work.
Right.
There's no two ways around
right.
it. It's not an opinion. Right? All you need to know is this. In relationship to vein flow and lymph flow in the body, you need to know this concept. High pressure naturally wants to flow towards low pressure. I'm going to say that one more time.
Right.
High pressure naturally wants to go towards low pressure because it's easier.
Right.
Right? It's like a water dam. You got all the water on one side, high pressure. If I open up the doors of the dam and I remove block and I make space, then the water knows where it needs to go. I don't have to tell it where to go.
Right.
I just have to open up the pressure valves, the drain. So once I tell you this, you can figure anything out. Right? The lowest pressure for vein flow and lymph flow is at the collarbone.
Love it.
So now that you know that, where do you think the highest pressure would be in relationship to the collarbone in your body? What body parts? If you went up, what's the highest place away from the collarbone if you go straight up?
Brain.
Your brain. Yeah, exactly. So what does that mean? If you're blocked at the collarbone, your brain is blocked. You're going to have a dirty brain. Okay? Now, what about if I go from the collarbone down? The fingertips are the furthest away down your arm. So everything in your fingertips wants to go up to your collarbone, but they have to travel that pathway to do it. Now, what's the ultimate furthest distance away? The feet. That's why they get the most swelling and inflammation and varicose veins and spider veins, because you have to fight gravity too to go up. Right? And those only move, the calf muscle pumping is one of the biggest things that moves the vein flow up,
right,
and the lymph flow up. So when you don't move, you lose your pump. Right? So they all want to get to the collarbone. So then my question is, what if there's blocks along the way to the collarbone? Or what if the collarbone drain is not as big as it should be because you got tightness and you got tension, or you got musculoskeletal issues or fascial issues that you're drained. And then now the pressure differences is not as great. The flow doesn't happen. So you backflow. That's the answer to the question of why you always start your lymphatic work at your collarbone. You open up the big drain first. And when you do that, the other areas naturally start going towards it because you open the drain, like your shower analogy, right? Like, I don't have to teach the water to go down the drain. I can help it, but it knows where it needs to go. That's why I tell people, you never, ever, ever start lymphatic work in your feet.
Right.
And everybody does. You have to start at the collarbone. And here's the thing. This is the big, big thing to understand. You start at the collarbone, and then you work your way down, and then you go from the feet and you work your way up because you strategically opened up the biggest places where you get the blocks. Now, I'm going to answer your question. Where are the biggest places where you get blocks? Around the areas where you have the biggest clusters of lymph nodes, which are the mini toilets in the body. Now, we know through moving lymphatics, a few things will help move your lymph naturally. One is movement, like moving yourself, using your muscles and your fascia. That's the pump. So when you're sedentary, you swell, right? So movement moves lymph, and people say, which type? Yes is the answer. Like, I don't care what it is. Just get going, right? And so, but most people don't move. And then breathing, particularly diaphragmatic breathing, moves lymph because that changes pressure inside the body, intra-abdominal, inside the abdomen. It gets greater, it gets less. It increases, it decreases. What does that sound like? Increase, decrease, increase, decrease. It sounds like a pump. Right? And there's no accident that most of your lymph sits in your abdomen, because that's the pump that needs to move it, right? So most people have a block in their abdomen, and that's going to compromise that knee we were talking about, right? But the lymph also has their own little tiny pumps in there. They're called mini hearts or tiny hearts. They're known as lymphangiones. Basically, tiny little smooth muscle pumps that help as well. Because if you didn't have those, you'd explode at night and get really swollen because you're not moving. And most people have extremely poor breathing at night. They breathe with their mouth wide open, and they have dysfunctional breathing. And that's why pain is worse in the morning when they wake up, because they're stagnant and they're full of what I call muck. Muck is just anything in your body that you're not supposed to keep in your body. It's called inflammation, right? And so those pull it towards the collarbone. Now, if you know that movement moves lymph, listen, your body's really smart. It's smarter than you are. It says, let me put these toilets around the areas of the body that are supposed to move the most. And the operative word is supposed to. It's your joints.
Right.
Your shoulder joint, your hip joint, your knee joint, your upper cervical joint, and the center of your abdomen, because you're supposed to move those things with walking, climbing, sports, athletics, things like that. But those areas get clamped down when, one, people sit all day, or two, they have so much stress and tension and tightness in the body from stress in life, because stress tightens up tissue and decreases blood flow. Or people have these repetitive patterns in training where tissue conforms to lines of force, so fluid has to move around the lines of force, so you have natural blocks based on your sport, right? Because right, you have this, awesome. The fibrosis begins to develop, and the compensations begin to develop. That's why variation, variability, and variety in training is great, so I can jostle your fluid around. Now, this is when people say to me, Doc, well, I'm an athlete, man. I move all the damn time. I'm a ninja. Or they go, I do all the breathing techniques. I've gotten certified in 50 techniques. Shouldn't that, my lymph should be good, right? Well, the operative word is should. Sometimes the blocks are too deep, and I'm going to come back to that word in a second, deep, or there's just too much of accumulation that those are no longer enough to move the blocks. That's like a stuck toilet. I always give this analogy. If you have a toilet that's stuck, right? Like a lymph node is a toilet.
Right.
And you got about 600 or 700 in your body. Most of them are in your abdomen, and the next majority of them are in your neck. And I'm going to leave that one hanging out there for a second of why we have to look at the neck for everything. So let's say your toilet's blocked. Sometimes you could go in there and flush the toilet, right? And you have pressure that pulls it under. Sometimes it's enough to unblock it. But have you ever tried to repetitively flush the toilet and it doesn't flush? What happens to the water?
Oh God, oh God, oh God, oh God, oh God.
Yeah, it becomes really close, like a Dumb and Dumber moment. You don't want to have that near the top, right? And that's going to overflow. And then I ask people, how in the world are you going to get that toilet open? What are you going to do to it? Are you going to skim the top of the toilet? That's like light brushing.
Right.
You can't. You're not going to clear that. You got to get a plunger. And then why do you use a plunger? What does a plunger do to the toilet?
More pressure. Right.
Pressure. It all comes down to pressure. That's the physics of everything.
So
right?
just to quickly pull this teachable moment out of this, because this is exactly why I wanted to talk to you about this.
Yeah.
Because so many people, when they watch some of my lymphatic videos, and again, I take very much a similar stance as you. It's like, you don't get to pick. Yeah, everything is here. It's a human being, all the different vessels and nerves and tissues, they're all there. I don't get to just say, okay, I'm touching with this much pressure, I'm only doing lymphatics now. So when people start to see me doing a little bit more depth of work and starting to get after it a little bit, it's like, I have a severely swollen extremity. This needs a little bit more gusto than just like a light little feather. But I'm being still strategic about it by clearing those proximal pumping stations or toilets, clearing those first so that there's some directional flow that can happen as I try to influence this fluid dynamics in a direction. So I love that you put it that way.
Correct.
Because I get so it's stressful for me as a teacher sometimes, where I get people that are stuck in such a singular lane or single-minded dogmatic approach to something where they kind of lose the forest through the trees. They're so stuck on what they were taught that they didn't pull out the concepts and use a little bit of their own common sense and clinical reasoning to say, okay, well, maybe I can enhance this by doing this a little differently based on the context of what I'm looking at in front of me right now. And so,
well, honestly,
that.
it ties back to what I said before. I mean, the physics of this doesn't change no matter where you got your certificate. All right? What's going to change is the context of the individual and the condition that you're working with. Like, I know when I have to put lighter pressure on something, one, because I actually watch the physical reaction of my client. You and I learned this a lot through studying through rock tape and the great work of the nervous system with Steve's work of being able to see if a nervous system is getting put through a fight or flight sensation. You need to back. I don't care if you're touching super light like a feather. You got to back off because you're pushing the system to a point where no matter what you do, it's not going to make a difference. But there's a hard, fast rule when I'm working with people on any technique is I try as best I can, but there are some circumstances where you might have to, especially after a surgical intervention and you got areas of fibrosis, to not put people in a lot of pain when you're treating them.
100%.
Right? Because then when you put people in pain, what are they going to do? They're going to tense up, and then they're going to close down the fluid stuff, and they're going to stop breathing, and they're going to close down everything that I'm trying to open up, and they're going to resist change.
Resist the change.
So when you work the lymphatics, that's why I teach the Big Six. And the reason I call it Big Six is because of these 6 primary joints of the body where you do your work. You just start from we'll go over those if you want to, but the collarbone out in these 6 places. And the order is the most important. It's 1, 2, 3, 4, 5, 6. It's not 6, 5, 4, 3, 2, 1 for a reason. And that reason is pressure.
Right.
And then I just want you to be on the right spots in the right order. What you do there I don't. That's up to you. I don't care
And it
what
also
the hell you
depends on the person. One of my favorite things about this too is I really have had so much success teaching this to people before they have surgery. Right. So
Yeah.
like, I'll always make sure, like I just got a call yesterday from one of my baseball athletes, and he unfortunately tore up his elbow, and he's going to have Tommy John surgery. And I'm on in the middle of the next week. And so he called me up because he wanted to start like setting up his post-op care. And I'm like, dude, let's get you in at least one day before you have surgery, because I want to put this entire protocol in place so that, if you're going to, you're going to feel like shit for a few days, and if you're not up to coming in for treatment, that's cool. You don't necessarily need me, but what you need to know is what you need to know, which is we can manage this proactively, understanding the system is now compromised, and a little bit of proactive work is an absolute game changer. And again, then like athletes are shocked and stunned. Like my favorite thing is when they go back 2-week follow-up to their surgeon, and their surgeon's like, what the fuck? Like, how is this possible that you have no swelling and full range of motion? I don't have to force flexion. I don't force range of motion. I'm not doing any of that. I am just savagely focused on fluid dynamics in that first 10 days. Yeah. And again, I just think I think we're leaving so much result on the table for people when we say, wait 4 weeks before you go to therapy. And in my course, I actually, I talk about, okay, here's your 3 phases of healing, right? You got your inflammatory phase, you got your repair phase, you got your maturation phase. And I said, this is a 10-cent answer to $1 million question. There are dozens of micro processes of healing that are happening in that first 4 weeks. 90% of the healing is going to happen in the first month. And we're just skipping that and going right to like, okay, you feel better? Now we'll start to move it. And it's already at that point, you're already fucked. You're already seriously behind the 8 ball. And for every person that and again, it's sometimes hard because I'm trying to tell people something. I'm trying to tell this athlete, hey man, let's get you in right away. But the doctor says, don't do anything for this amount of time. I'm like, listen, I'm not saying we're going to start doing fucking plyometrics and, med ball slams and deep squats. I'm saying let's get you on the table and start moving some of this fluid around, or at least teach you how to do it. And then the other things, the red light therapy are great. And, here's a percussion gun. Here's how you can use this as a really great way to move fluid. People want to crap on percussion guns. I'm like, I think the most underrated aspect of a massage gun is it's a great way to move fluid. Do you agree with that?
Oh yeah, 100%. Yeah, first of all, when you use it on an area, it's moving everything. It's influencing. So people say, Doc, what tissue am I influencing here? Yeah.
Yes.
Right. What tissue is causing pain? Yeah. Like all of them. You can't differentiate that. So you're moving everything, and you just have to remember that now that you know how fluids move, it matters where you put the gun.
Right. Now the location is more. All right, so can you share us
That's
with
more
that?
important than anything. So let's talk about it. Like,
let's start with the big six.
If your knee is swollen, I could use the gun around your quad, but you better not.
Right.
Until you clear the upper parts first.
Yeah,
right?
Absolutely. 100%.
And that I love that story because that's exactly what we said is that, what is the state of your body before you go into a surgery? It's going to make a difference on how well you recover, because surgery is a traumatic experience. You're going to have scar tissue from that surgery as well. So every surgical intervention always needs lymphatic work afterwards, but I want you to get it before you have that, and not just the lymph around your elbow.
Right.
That's the thing, because if you're going into that Tommy John surgery, you're gonna have an expert on the friggin' elbow.
Right.
They're not gonna know lick one. They might not even know lick one about the lymph to the elbow anyway.
Well, they're just not even considering it. Yeah, it's not even.
Well, their job is to fix it, sew you up, and then send you to therapy. But the therapist, unless you get somebody like yourself who understands it. But it's the fluid dynamics of, because that elbow is attached to this thing called the rest of your body.
Right.
And if you have a pressure problem in your arm, that's beholden to the pressure everywhere else.
Right.
And that's what people forget. It's one unit. It's one piece. it's not parts.
And that fluid's moving through the whole system. It's got to move through that whole system.
Yeah, and what many people don't understand is that you can have a problem with your lymphatic system because there's a problem with a lymph node in an area that's not even anywhere near where your symptoms are, because that influences the pressure system everywhere else. Right. What do I mean by that? You could have an issue in something in your knee where you have lymph nodes in your knee, of course, but I'm going to contend you may have an issue with a lymph node in your shoulder as well. That's going to influence how well that knee does, especially when you understand how veins go from hips to shoulders, okay? But yeah, when you work the pressure systems, you would always work the 6. So let's go back to the knee example because it's a great one. The flow from the knee, when you work the knee, has to go up your leg, up to your abdomen, up along your spine, behind your sternum, and to the left side of your collarbone. That's where it's got to go. That's a long way.
Yeah,
right?
That's quite the journey.
Trust me, there's going to be a block up there somewhere.
Right.
Right? And that's where there's a big difference up in this region, why I look so much for my athletes to make sure they have good thoracic spine mobility, good sternal mobility, rib cage mobility, good excursion in here, because the more you can expand your rib cage and breathe through this region, the more negative pressure you can pull towards the collarbone and pull that fluid, because the lymph fluid and vein fluid actually get sucked up towards that area, not just pumped, but a suction effect.
Like a negative pressure. Right, I gotcha.
Yeah, so it's a pull like this. But if you can't open in the rib cage and you're really tight up here, and most humans are, then the pressure difference is not as large, and then you can't have as much suction effect.
Yeah. Right.
So you always open up the drain at number 1, and then I go up to the largest lymph node in the neck, which is on the side of the neck behind the angle of the jaw on the left side and the right side. That's an area that's really blocked on a lot of people because they have poor upper cervical spine mobility.
Right.
They don't move well up
And
there.
these are the same lymph nodes, like if you get like a upper respiratory sinus infection, those are the ones that are freaking golf balls, right? You're like, oh, yeah, here we go. All the glands and lymph nodes and that angle
that's
of your
actually
jaw.
Yeah, that's actually the area that when that gets blocked, you'll typically have issues higher up in the face, throat, sinuses, ears. You'll have brain fog and inflammation for sure if you're blocked in there.
Right.
Okay. Because that'll block the brain. But many people just forget that right here. Listen, everybody, that's one of the 2 primary ways you're going to get blood to your head is up that way. And that's the exit route of blood from your head. You might want to make sure that's open.
Right.
Because that's kind of a big deal. Right? Because then you'll compromise the function of your brain over time, and that's going to influence everything. Then that's spot number 2. Then spot number 3 is at the glenohumeral, axillary, pectoral, shoulder joint, the whole thing. This way. That's why tight pecs, rounded shoulders, poor posture, looking down at TikTok 20 hours a day, that's going to clap that down, right? So that's tight. Then number 4 is the whole abdomen from the navel up, the whole region. Okay? Everybody's got a block in there. If you're alive on this earth, I know that's a mess. And then number 5 is the crease of the groin called your inguinals at the hip joint. Now, that's a big one to know because guess what, everybody? That's the primary blood flow pipe to get anything down to your leg.
Right.
That's it. That's how it gets there. So if you're blocked in the groin, your knee's not getting better no matter what you do. I don't care. Right? And then the last one, number 6, is behind the knee.
Right.
The popliteal one. So in my world, what you would do is you would go 1, 2, 3, 4, 5, 6, and then you would treat directly around the knee with all your stuff, and then you would stroke up.
Right. So go like 1, 2, 3, 4, 5, 6, 6, 5, 4, 3, 2, 1, and then clear them again. Is that like a general
you can go
good
up,
way to go
or
about
then you go back and you isolate around the knee and the quad, and then you do your traditional kind of easy petrissage, effleurage, stuff in that region there.
Yeah,
whatever
distal
you
to
want to
proximal, start moving it in a vector.
Yeah, or even if I'm going to do laser, or I'm going to do gua sha, or maybe I'll do a rock floss band or stuff like that, you would go there afterwards, because what I know is that I opened up the channels both ways.
Right.
In and out. Now what really hit this to me, man, is because when I was really, really sick, I had to go back to basics, and I was really struggling to get better. And I said, okay, well, let me break this down of what does an individual cell need to heal itself? Because if I can figure out how one works, I can figure out how the other trillion work, because they're pretty much the same, right? And it's what we said before, is that, cells need nutrients and oxygen, and then they need to get rid of the waste after they use it. And that's a fundamental one right there. If you don't have that, I don't care. All the ones are not working.
Right.
And then I came across a phrase in classical osteopathic medicine from the late 1800s, founded by Andrew Taylor Still. And 3 words changed everything for me. And I got the answer of what I think is why I wasn't getting better and why people struggle. And I'll break it down with what I just said. It was this: drainage precedes supply. Drainage precedes supply. Now, very straightforward, very simple. So what does precedes mean? Comes first.
Right.
Right. What's supply? That's everything that everybody tries to do to heal an area by changing your nutrition, changing your breathing. Let me give you oxygen. Let me give you good foods that are bad food. Let me do all these things to try to supply the injury site with stuff so it can heal itself. And that's what I was doing. Even for my autoimmune disease, I was taking supplements galore, like 20, 30 supplements. I'm doing all this nutrition stuff. And I'm like, dude, I'm still on the freaking quicksand here. And then I said, oh, what about the drainage part? Right? Because the body's not going to let you put something in that it can't get out. It's not stupid. It's not going to let you do something if it knows it can't handle it. Right? And you're not going to get an influx when you can't get an outflux.
Yeah.
So what you do is,
perfect sense. It makes so much sense when you put it that way. It's like so. It's
well,
like,
it does. It's so easy. People say it can't be that easy. I'm like, well, who the hell told you that? Of course it can. It's like when you understand math, you know math. It's just, you got to know it. And it's like 2 + 2 = 4. Big sixes, 2 + 2 = 4. And so once you do the drainage part, and when I started to do the drainage part, for me, when I was sick, for my pain clients, guess what happened within about 3 days? I made better progress than I did in 3 months, 6 months, right? And in 1 month, I lost 30 pounds of swelling, inflammation, edema, and body fat.
Wow. Because
I opened up my drains. And then now when you open up the drains, what can now get in?
All the stuff that you were trying to feed it before, the nutrients, the oxygen, had a place.
Because it's like, listen, man, just because you take a supplement doesn't mean it's going into your cell. And just because you breathe oxygen doesn't mean it's going into your cell. That doesn't mean that at all. That's what you got to make sure happens. And I'm going to tell you right now, the only way that sucker's getting in there is through blood, and it's got to cross through this fluid to get to the cell. And guess what controls the fluid that sits around the cell? Your lymph. That's it. So if you got a lymph problem, you're going to have a problem with all the other systems. You got to clean that fluid up so stuff can get in, right? So this is what I usually tell people is that, you have these trillions of cells and they poop all day long. Cell poop. It's called metabolism. Right? And your neurons do it too. When you think and use your brain, you wire and fire. You make a ton of waste in your head, man. Okay? So that poop, and I say, where do you think the cell poop goes? Same fluid.
Right. It's immune fluid, right? It's moving around. It's pulling it out, getting it filtered.
Yeah.
And then we
So
poop.
this is one of the reasons why people get a detox, or they get sick, or they get worse before they get better when they do lymphatic work. Because, and this is really important people understand, all that muck sits in the interstitial fluid, but it's not going to get bagged and tagged until it gets to the lymph node. When it gets to the lymph node, that's the scanner. That's the immune system scanner. And then it reads it, and it tells your immune system what it is and what it needs to send out to kill it, primarily the macrophages and the cytokines. Okay? But that happens when it gets into the node. So when these nodes are blocked for such a long period of time, and then you open them up, the stuff starts coming in, and the immune system begins to do its thing. And all these detox symptoms are just symptoms of your body trying to kill stuff, is what it is. But that's why you have to go slow with this work, because there's a tolerance level to things where an overwhelmed immune system and nervous system is very easy to overwhelm.
Right.
And I'm sure you probably run into this all the time with your athletes. They just want you to go hashtag hard all the time. And you have got to back them off the ledge of more isn't better, better is better, right?
Well, I think for me, and I think, because I'm like the lucky one, right? I work with neurologically intact, metabolically intact people, for the most part, like 90.
Wow,
90%
you found the
of my clients.
unicorns then, huh?
Yeah, well,
Damn.
again, athletes
That's good.
generally do a lot of the basic stuff pretty well.
That's true.
And
Yeah,
so, maybe, again, high school kids, notwithstanding, because they just, like, they're young, right? So they could treat their freaking body like a dumpster fire, and they
can do kind of
they can kind of get away with it a little bit because their shit's kind of fresh out of the factory, right? But would it be fair to say that the larger the health compromise of a person, maybe the slower that needs to happen? Because I feel like I can be a little bit more aggressive, with some of my pro athletes, because they're eating clean most of the time, they're sleeping, they're moving every day, like they're the big buckets are full, right? So I feel like for them, when they do have that acute injury, they do have maybe a subacute swelling or tendonitis or something going on, and I employ some of these methods, the impact is immediate and huge. And I can definitely see, because I have still worked with people, friends, family, clients, relatives that are like, Mike, we really want you to see them. And, they come in, they're a little overweight, they're deconditioned. I think that's a big piece, right? Is, if that person's cardiovascular system is already kind of behind the eight ball, it makes it a lot harder to make some of these progressions. Is that I know that's a generalization and that's not the rule, but would you say that that's a fair generalization, that the larger the compromise of just the individual, maybe the slower we have to progress these things in terms of like actual intervention or treatment?
1,000%. I would agree with that. Yes.
All right.
Yeah, I would.
So again, I get this message too, like I'll get massage therapists or like, very, people who've been trained in lymphatics and that are working with athletic populations, and then they'll see my content and they'll be like, oh, dude, you're going too hard. And I'm like, but you don't, am I though? Am I going too hard? I don't think I am, because I'm getting the result.
I'm going to always say context. Not for your athlete, you're not.
Right, right.
But trust me, there's the human body, the lymphatic system is designed to take way more pressure than I think we give it
Credit for. Right.
So for your athletes that you're working with, your pressure will alternate, your depth will alternate, because you got different levels of lymph nodes. It's like the analogy that you talked about in your plumbing, and this is what's really important for people to understand, is that the lymphatic system has smaller pipes into larger pipes into big giant pipes.
Right.
And the smaller pipes are at the skin. The deeper pipes are in your gut and along your spine. Trust me, man, you can lightly brush over your skin all day long. You're not clearing that out. You can stay there for a year. You got to get in there, man. You got to dig in there deep to clear that stuff up. It's like if I have a block in my house, I can take the plunger and I can open the block in my toilet. But what if I'm blocked in the street?
Well, you're blocked at the main. Yeah, you're fucked.
Yeah. I mean, you got to go in there, right? That deep sewer line to open that up, especially when you're going along the deep abdomen. The largest lymph node in the body sits in the center of your abdomen, and it takes all of the lymph flow from the lower body, and it takes the lymph flow from your organs. 50% of your entire lymphatic output comes from your liver.
Wow.
And your liver dumps into the cisterna chyli. And you should also know that most of your vein flow, your portal vein from your digestive tract, goes into the liver. And so what happens if your liver is congested and stagnated and it can't get the lymph out into the largest lymph node? Well, it goes there and it backs out everywhere else. And then that fluid pushes the vein fluid back out. And then you have stagnation in vein fluid. And trust me, brother, pain's going to show up somewhere.
Right.
When blood flow doesn't move and you can't drain lymph and you can't drain veins and get blood in, you're going to have low oxygen and you're going to hurt somewhere. Trust me. Okay.
I'll tell my classes when I'm teaching, like whether it's rock tape or some of my stuff, and people be like, I was like, anybody have surgery? And there's always like a few hands that go up, and it's like, did you have a compression wrap on that? And they're like, oh yeah. I was like, how'd that feel at 2 a.m? And they're like, horrible. It's like, yeah, it's throbbing. You want to chew your leg off. It's so bad. It's like, well, think about it. Your immune system is the most active at night. You're sleeping. That's your body's prime time for saying, all right, we got everything. All the other systems are shut down right now. Let's take this time and start cleaning up the house. Let's start getting this healing process going. And if you're just compressing tissue and reducing that space, and again, I understand why people do it. Does compression help with swelling? Yeah, sure, but it's reducing interstitial space. It's compressing the space in between cells. And so if your body's still trying to pump in that healing factor into less space, you're just going to have more pressure. So you're going to have more discomfort and more pain. And so maybe some of the things like, I talk to my athletes about doing their pumping stations, obviously a few times throughout the day, but especially before they go to bed at night, is maybe one of the most important times that they could start to work on some of that stuff. And it's easy, right? It becomes part of that nighttime routine. Okay, I'm going to take my gun, I'm going to take my hands and start, the tapping or just moving stuff in circles. And again, it's like the reports that we get back are just, people are moving along. And again, they think they're just moving along because they should be moving along that quickly. But it's like, no, you don't realize if you weren't doing some of these things that are just augmenting what your body is trying to do on its own, I think you probably would have a different experience. And where that was kind of leading me into like maybe my next question or segue is, a lot of people are talking about hormone replacement therapies. Actually, just my last podcast, I spoke with our HRT doctor that we refer and collaborate with a lot. And, we were talking about TRT and testosterone and then the people who abuse testosterone. And, all of a sudden now they're so big and there's like, you think, okay, bigger pumps, right? But a lot of those guys end up having like high blood pressure, right? And so like to your point about the liver, being stagnated or just overtaxed, it's like, well, you've got all that blood. If your blood pressure's high because you're just pumping so hard and so fast all the time and you can't clear, you think that plays a role too in maybe some of those symptoms guys get with, some of the secondary, side effects of, maybe using gear and that kind of thing?
Well, once again, it comes down to pressure and physics of how things move. So I'll start off with I think it's a fascinating fact. You have twice as many veins as you do arteries.
Wow.
That's cool to read on Wikipedia, but then I want you to stop and think, well, why the hell would that be? Well, to me, it tells me that veins are more important than arteries if I have twice as many as something.
Sure.
75% of your blood pools in the veins at one time.
Wow.
So you have a big leeway to become a hot mess before you know it.
That's that's an interesting. Okay, so you've got, because a lot of that blood is in the veins, stashed in the veins. You're saying you don't notice it right away. Behind that, right? Before you're symptomatic, you're already. It's been,
you got a big bucket
been burning for a while.
Yeah, you got a big bucket, right? And we know that the lymph and the veins go together, right? So vein problem, lymph problem, vein problem.
Wow.
But let's talk about pressure. So if you've got stagnation in the liver and then you get backflow of blood, first of all, it's going to backflow into your intestines and you're going to get leaky gut syndrome, right? but it's going to backflow down into the legs, and then that back pressure is going to push into the arterial system. And then what you're also going to get is you're going to get blood that's more viscous. It's thicker. Because now you're going to change the concentration of white blood cells to red blood cells because you have a problem with lymph drainage. And then in order to move more viscous fluid, right, or in order to move backflow pressure in the arteries and push it through, well, how are you going to do that?
You gotta work hard.
Well, your heart's got to do it.
Yeah.
So you're going to get higher blood pressure because it's got to pump harder. So when you begin to open these fluids up and you do this thing called hydration, which is important because, listen to this, like 70% of your blood is water. 90% of your lymph is water. Hang on to this one. 99% of your cerebrospinal fluid is water. But what happens if you're dehydrated? You're screwed, man.
Right.
You're viscous right off the gate. Right. And back to what you were saying before is that we know through research is that when you sleep at night, if you sleep at night, that's when you flush the toxins and debris from the brain. Right? And then I'm going to ask you, okay, so your brain toilet is flushing. Where's that going? And once again, you better point to your collarbone is where you better point. And it has to travel through the deep lymph nodes in your neck to get there. So if they're blocked, they're going to come straight up. Then you're going to get neuroinflammation and brain fog, and you're going to live in muck. You're going to be tired, fatigued, lethargic. It's going to be harder to think. It's going to be harder for your brain to let you make a change because you have low energy in the body and it doesn't want to change. And then here's where I'm going to send it home. Where do they tell us that pain is in the body? In the brain.
Brain.
Not in the tissues, in the brain. Well, wouldn't it be a really good idea to make sure your brain is not living in muck? Because what I'm going to contend is that when it is, you're going to change your perception of pain.
Sure. Yeah, I mean, it makes,
and that's why when you do lymph work, people say, Doc, this is the craziest thing in the world. But when I started to do these areas like the Big Six, or you do the pumping, you teach people, say, is it possible that I feel better in X, Y, Z? And I'm going to say, well, of course it is. Because all those things, all those cells that are contributing to X, Y, Z, they still need the same stuff that the cells that don't have X, Y, Z need. It's still the same tank. I use a fish tank analogy. Like, fish tank, just clean your damn tank. And then if you clean your tank, the fish in the tank have a better chance of not being dead.
Right. They're thriving. And it's the same water in the tank. But if you have a good filter system and that water remains clean and clear of debris and waste and all the fish poo, that fish is going to thrive instead of trying to survive.
It's exactly
right?
what we just said. I just want you to change fish for cell. And what I tell people is that you ever looked inside of a fish tank that's dirty and has fish in it, and you see them, you come up close to the glass, you see things growing on it, right? That's because you got bacteria, parasites, fungus, and all sorts of yucky stuff in there that's causing disease. Well, that's what's happening inside of you as well. But I really want you to look at how they're breathing. What are the fish doing? If you're on video, I'm like this. They're struggling to breathe.
Yeah.
Well, that's what happens with your cells of your body. And then that's when you get PAIN.
Yep.
Pain. Because without oxygen, forget it. You're done.
You know, this is just one of those topics I think so many people just take it for granted. It's just such an
They do.
oversight for most therapists, trainers, clinicians, physicians. It's really almost a crime that we don't learn more about. Like, again, it's like, I think you nailed it before, and it's such a great takeaway. And I feel like that's the bit for the whole podcast is like, we want to talk about all the stuff we're doing and putting into the system, but where does it go? It's got to go somewhere from there, right? Like, we're eating food. You got to eat, Great, put energy in the system, but you got to shit too. You got to poop.
Yeah.
You can't just keep eating and never poop and get rid of, you know what I mean? And it's like the cells do that, but we do that. Why? Because we're just a giant clump of cells. Giant clump of cells all taking that energy and those nutrients and using it to make proteins and create collagen and heal and, think and do all these cool things that humans are able to do. But it's that single cell. If we, like you said, I love that. If when you understand how a cell works, you can really start to understand how the organism works too. And I think people want to crap on that. Like when we start to take physiology and then, you get now the big trend, especially on social media, is like, oh, the human trials. And it's, okay, that's great. And we could look at human trials. But when you start to take 10,000 people that are all at different stages of health, and you try to draw these giant conclusions from a hugely, vastly different population, of course your answers are going to be somewhere in the middle. You're not going to really address the individual. You're favoring the group, and that, there's so many different nuanced pieces of this could be a big piece for a lot of people who are struggling. They're just not considering it because it's not mainstream topic.
Well, exactly. And that ties into something that I say all the time is that, and I actually learned this from Diane Jacobs, who teaches.
Love her. Awesome.
She said that it's not about the anatomy. You're not treating anatomy. You're treating physiology. What does that mean? Like, it's how the anatomy works together. That's the physiology part. So I love it that you know the anatomical names, but that doesn't mean squat to help you clinically until you understand physiology and how all these things work together. These are the systems. And this is going to tie me into what you said before about trials are great, man. But if my personal client wasn't in your trial, I really don't give a crap. Because it doesn't necessarily apply to them, because I have to deal with the individual living, breathing human being in front of me, because they're going to bring their story and their physiology to the table that's going to be different than somebody else's. And that's where my history comes into play, right? And my manual assessment. So in my world, if you don't take a really in-depth history and you don't do a manual assessment to put your hands on people, which very few people or have the skill set to do so. Mm-hmm. There's a science to that, but there's also an art to that. Then you're missing a huge piece of the component. Because I'm going to tell you this. You can do an MRI of a body and you can show me parts, but I'm going to put my hand on somebody and I'm going to make them jump off the table because they didn't know they had inflammation in that part because you didn't find that on an MRI, but I found it when I stuck my finger in there. Right. That is a huge part of getting that person well, right? I'm not saying you don't need those to take a look, because I got to make sure that you don't have bone cancer, for goodness sakes, when I'm treating you. But I also have to go by what I feel with my hands and your history, because that's where I'm going to get my answer. And that's where medicine, I'm going to tell you right now today, sucks.
I agree. I absolutely
They don't know
agree.
how to do it. You first of all, sometimes it's not by their own fault, because we're in a system that's broken. I have a lot of brilliant therapists and doctors, and they get 15 minutes with somebody.
Yeah.
And they're like, I just can't do what I want to do because I'm in a system that doesn't allow it. And trust me, if you have somebody that comes in to see you for knee pain and you mention lymphatics and that, you're not going to get approved for anything.
Sure.
Because they're not going to connect the two together. But that's your job, is to understand that and to know that. And this is something, in my opinion, is that once you see it, you can't unsee it. Like, I just showed you the friggin' matrix. It's been there the whole time. And to me, it's a fluid matrix, because nothing happens without fluid flow. So everybody is about fascia, and I love that. But I only work on fascia in relationship to how does it change the flow of fluid with where I'm working in relationship to where the fluid's going next. If you can tell me that, then you're going to figure it out.
I love that, because I'm even just, it makes my wheels spin too, because I work with a lot of baseball players, and one of the adaptations to a throwing athlete is they'll start to have more scapular depression and downward rotation on that throwing arm.
Right.
And all of a sudden that collarbone goes from that nice angulation, and over time now it's level with the ground. You know what I mean? They get that collarbone depression, and then they wonder why. It's like, oh, I started getting... I think every throwing athlete has subclinical TOS entrapment, thoracic outlet entrapment, that they're aware of or they're not. It's there, though. And all of a sudden, it's like I'll just touch their subclavius or just that tissue right on their column. They're like, oh, my God. It's like...
I bet you they love that one.
Holy... Well, but, it's so funny, though, because I'd be like, all I'm going to do is... And I'll show like pre and post, like, so, hey, before I work on you, here's some basic range of motions, and their internal rotation's already a little bit juiced up and limited. All I do is just work that collarbone, maybe a little bit in the scalene, just all what you're saying. And again, maybe I'm taking a little bit more of like a biomechanical kind of approach in terms of thought process, but like you said, you can't differentiate. You're doing it all, and all of a sudden, all the range comes back. It's like, I didn't even touch your rotator cuff. I didn't even touch it. But maybe there's that neurological mechanism, right? It's like, okay, touch, brain integration, that's going to change maybe some motor output. But we're also changing fluid dynamics and fluid flow. Maybe that's unlocking some doors, but it's all happening simultaneously. And I think people, probably more manual therapists, are treating lymphatics. They're just doing it by mistake. They don't realize they're doing it. They're like, look at this great result I just got. But they're just moving fluid, and they just didn't consider that as part of what they were doing. They're just working on muscles, right? And they're working on fascia.
That's so funny you said that, because it reminds me of my, Dr. Eric Kopp from Z Health.
I love him. Yeah, he's fantastic.
And he always said, I can't remember the exact quote, it was something like this, is that everybody's practicing neurology. You're just doing it by accident.
Right. You're practicing
You don't know you're doing it. It's the same thing with lymph. Like every time you touch the body or move the body, you're moving lymph, right? But the question is, do you have a purpose to it? Is there an intention to it? Right. Is there a direction to it? That's why one of my hard, fast rules when I treat people is that, so I'm a chiropractor, and through training, most of the time we would, start on the back, right? Because I'm concentrating on your spine, and I would lie you face down on the table and look at the spine, look at the leg length, stuff like that. But once I understood fluid dynamics, then I thought to myself is that I start you on your back first, okay? Well, usually standing, because I watch how you move first, but on your back. And I started to have better results. And I said, why? Well, because everything on your back has to flow towards the front. And everything that needs anything on the back has to come from the front. So why in the hell am I going to start back there? I got to go to the front and open up the routes. And then all of a sudden, when you flip them over, you have a different back. Right?
Awesome. Yeah,
and then I'm
it
like,
makes so much sense,
dude. It's sitting there for. I've been doing this thing for 33 years. It's been sitting there the whole time. It's the Mache Feldenkrais quote of "It's the elusive obvious, man." It's right there.
Right. We just missed it because we weren't looking for it. Right. We're not looking for it, so we miss it.
Well, you know what? I'm going to cycle back to something. Is being sick. I was really sick. In hindsight, like many people who go through that, it was ultimately a blessing for me, because you don't really change your thought process of what you're doing when you're comfortable because you're comfortable. It's something where you have to go into the abyss, figure something out, come out of it for yourself or somebody else, and then you realize this changed how I see everything. And I would not be talking to you right now about this or helping the people that I am helping right now if I didn't need it with myself first. So I'm actually quite grateful that I went through that. Otherwise, I would just still be continuing with what I'm doing and not be talking about lymphatics at all.
To me, it pulls on my heartstrings because my story is exactly the same. If I had never had that catastrophic knee blowout, I would have probably been an architect somewhere in an office building in a cubicle, like just drawing up reports. And it gave me my life's purpose. And it was an unfortunate opportunity. And now I take that as kind of like a badge of honor. And I'm so grateful for it, because that pain and that struggle taught me, or it forced me to look at things that I wouldn't have considered before for myself, selfishly. And I tell people all the time, they're like, Mike, how do you know what you know? It's like, because I was so hurt and in so much pain, and my identity was destroyed as an athlete, that I just had to find an answer for myself. And it was selfishly motivated in the beginning. And then I started stumbling across all these little nuggets, all these little pearls that I've been able to now put together and share it with other people. And that your story resonates with me, because your own triumph has turned into triumphs for so many others, and that you've been a catalyst for that change. And so obviously I thank you so much. You impacted my career at a time that I was ready to walk away. And I don't know if you knew that part. I did
not know that.
Listen, I'm an athletic trainer, and everybody looks at athletic training in healthcare and they go like the worst of the rehab bunch. It's like we're underpaid, work a ton of hours, and I was just I was working at a PT clinic, and I went from treating and training like Olympic athletes and professional athletes to like folding towels and wiping tables and like stretching people on basic protocols. I was like, this is just freaking garbage. And then I sat down in that room, and it was funny because I had taken a kinesiology taping course prior to that, and I hated it. I was like, this doesn't make any sense to me. Yeah. I don't get it. And during the class, right, I had only signed up for day one. I don't know if you remember this or not. I only signed up for day one because I needed the CEUs. And we start doing the first demo, right, the first lab, and you came up to me like, yo, brother, you've done this before. I can tell. I'm like, yeah, I've been taping for a few years. I just don't know why I'm doing it. This doesn't make sense. I'm switching stuff on. I'm switching stuff off. Like, it never made sense to me, And then when you broke it down and you were like, the integrated neurology part and your passion and, how much you were able to weave in these stories and clinical anecdotes and research and the way you molded it all together, it completely reinvigorated me at a time that I was ready to walk away. And I felt so validated as a clinician. I'm like, man, finally, I found somebody that kind of thinks outside the box a little bit more along the lines that I've been kind of stumbling onto in my own journey. And I just felt seen. And then all of a sudden, a year later, I left that freaking PT practice and I started my own business. And, that was like 10 years ago. So, and again, I don't know if you ever knew that, because our time at Rock Tape only overlapped a couple of years. And, but like, it was so for me to get the call from Allison and Steve to like teach, and I was just like, man, talk about full circle. And then obviously to be able to sit down and talk with you about this stuff now it's just super cool. It's super cool. The invisible threads of life that kind of connect people and maybe put us in the same room at the same time for a reason. I don't know if you believe in that spirituality, but I absolutely believe that I was meant to sit in your class, and I needed that messaging and that passion and that exuberance that you brought to every single class. And I remember I signed up for day 2 right on the spot. I'm like, I'm coming back. This fucking guy's the best. I need more. I need 8 more hours of this, And we just had such a great time. I bought it was fun. $500 worth of tape. and then, but yeah, and like the rest of the story is written. But, all right. So as I know, I don't want to keep you too long, but I do want to maybe big broad brushstrokes, right? Like, what are the basic things that people can do, people that are hurt, people that are injured, people that are sick, like from a lymphatic system approach? What are the big brushstrokes? What are the big pillars in your mind that if we just focus on some of these basics, a lot of the stuff might start to turn around? And then when do you think it's time to pick up the phone or go online and call Dr. Perry and start to get maybe more assessment on, some of these things as well?
That's a great question. Well, I say this every time. The first step in making a change to your lymphatic system is the awareness that it matters and that you have one. It's on your radar now, right? Because you can't control something or change something until you become aware of it.
Sure.
So you start to pull that thread. And I encourage everyone, to learn about lymphatics from many different sources, not just from me, but also from you, because you have some fantastic work. Because what you got to learn is what we talked about the whole day, is that everybody has a different perspective on it and how they use it. And maybe when you hear it from, say, you, it'll click for them. If they hear from me, it might click from them, or they like the way that I deliver something or you deliver something. But I also want you to be careful and not fall into some lockstep tunnel vision if there's only one way to do something, because that's not correct. Okay, there's just different ways to do things.
Sure.
Right. And so the awareness is the first part, and then some of the basics of just trying to move more of your body more often and do movements that you don't normally do. I love just simply jumping up and down lightly on the balls of your feet, or getting rebounders work awesome. So vibration plates work great. The massage gun works awesome. I use vibration massage balls because in my world, I see a lot of people with chronic pain and they have a lot of sensitivity. They can't tolerate a gun at that point. It's just not my base. But it's the same premise to get things going. And then also learning to do different breathing techniques, particularly diaphragm breathing techniques. And people say, what's the best way to breathe? Yeah, like just do them all right? But now that you know about how fluids move, it's just something as simple as massaging these 6 areas that I talked about before, or when you talk about them for your pumping stations, to open up the flow. This is the big thing. Open up the flow routes and then breathe. Open up the flow routes and then move. Open up the flow routes and then work out. And what you'll notice, and I know that your athletes notice it, is like, holy crap, man, that was like a different workout than I had before. It felt different. And I recovered different as well. And then you just have to ask, well, why in the world is that? We just told you all day long, opening up the flow routes that you need in order to accomplish those things.
Yep.
And then you just, somebody said, I can't remember who said it, it's like, give the body what it needs and then move out of the way.
Right.
So if you do the fluid flow, that's a good start.
That's great. I love it. Right? Drain, proceed, supply.
Think about those 3 words, just encompass everything. It's like, yes.
Yes.
The order makes a difference.
It does.
That is about physiology too. That's called dynamical systems theory. The state of the system depends on what happened to the system before what just happened.
Right.
Right?
Yeah. Yeah.
That's exactly what drainage precedes supply means.
I think that's a perfect way to wrap this up. Dr. Perry, how do people reach you if they want to come see the master himself? Tell us about your courses that are available. What are the different ways? I mean, obviously, if you're not following at Stop Chasing Pain on social media, you're doing social media wrong. If you're a clinician, you've got to be
Thank you, brother. I
following
appreciate that,
this man. And again, just the volume of content that you pump out just still freaking astounds me. It's just like, bro, you are a machine. But how do people reach you? Are you still treating? Like, what are you passionate about now? What are you working on now? What can we expect from Dr. Nickelston in the future?
Well, first of all, before I get into that, I just want to say a sincere thank you so much for having me on today.
Dude, thank you,
it's always
man.
wonderful to talk to you, and thank you for sharing that story of the first time that we met. I did not know that, and I would like to take the opportunity is that, man, you're a rock star in your own right, man. I love what you're doing. I love how you do it. You're doing it as you, which is something that really comes across, and I follow you on Instagram, and man, I messaged you privately. I am so proud of you for the center that you put together there. It is just gorgeous, and I know that was something you've worked towards, and you got that dream. You made it happen, so congratulations. And
Thank you, my friend.
I encourage people listening as well that maybe already follow you to take your courses, which are awesome. Your Ice Age one was next level, and then the work you do with the light with Fringe, our friends at Fringe. So I'm going to pump you up a little bit here before I get into that. So thank you very much. And now you're doing that for other people, right? Inspiring them. And I'm really easy to follow, dude. I've been in this game a long time for sure. So you can just go to my website. That's the hub for everything. StopChasingPain.com. And if you look around, you'll say, "Holy cow, he's on this thing too! Like I'm everywhere." Just follow the threads from that, and you'll also see our courses that we offer. It's many different. I tried to give many options and opportunities for people to learn in different formats that they're comfortable with. And I would have to say you'll probably find me most often on Instagram as my favorite channel to be on to share information. And at this point, it might be an unhealthy amount, but I digress. It's still a wonderful place to be. But that's where you can find me.
I love it. I love it. Man, you're a legend, brother. You're a legend. I can't thank you enough on behalf of the entire rehab, training, movement community. I mean, like, again, you're just one of the GOATs and one of the trailblazers. And again, I know I speak for a lot of the rock tape instructors especially, but, you know, you paved the way for a lot of us, and I cannot thank you enough for that. And I can't thank you enough for your time and for your knowledge and your wisdom and just your charisma. Man, I just feel like I'm gonna go work out right now and freaking run through a wall. I think that's how I feel. So
You got it, brother.
anytime you're on Long Island, if you want to come grab a lift, come on down.
Yeah, dude, you're so close to me because
I know.
I'm in New Jersey, right outside the city. We got to make that happen.
Yeah, we'll get together sometime soon. But Dr. Perry Nickelston, everybody at Stop Chasing Pain. You don't want to miss this one. Thank you so much, my friend, and we will see you on the next episode of the Movement Underground Radio.